Thank you very much, Mr. Speaker. Now, I've been pushing this government to come up with a proper plan for dementia care for nearly 2 years, but Albertans continue to struggle. The Dementia Strategy put forward on the last business day before Christmas simply is not good enough. Albertans are right to question the NDP's commitment to dementia care when the word dementia is mentioned only a single time in the 165-page business plan for the Government of Alberta and exactly 0 times in the 172-page fiscal plan. To the Minister of Health, is your dementia strategy working, and how do we know?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Our targeted and strategic approach will lead to quality care, timely diagnosis, better brain health, and stronger community supports for years to come. And I want to commend everyone in the community who was involved in this. We had experts in public health, and we had people with lived experience. As an Albertan, Roger Marple said, as a person living with dementia, I felt never more optimistic. I would like to extend my heartfelt gratitude to the provincial government on the release of the Dementia Strategy. I really want to say we're fighting for Roger, and we're happy to work with him to help address the needs that he has and his family has.
Thank you, Mr. Speaker. Those are a lot of words, Mr. Speaker, but I'll ask simply again, what specifically has changed in the time between December 22nd, when you released the Dementia Strategy, and today?
Honourable Minister.
I'll go back even a little bit before that, Mr. Speaker, because I think it's important to note that since 2015, roughly almost $7 million has been invested in measures specifically to give families tools to support their loved ones living at home or in community, including expanding the First Link program, Mr. Speaker, almost $2 million, mental health first aid for seniors, more than $500,000, and we specifically have dementia-trained nurses through HealthLink. If anyone calls 811, they can get support from dementia nurses right over the phone, Mr. Speaker. These are a number of important initiatives that were driven by community to help support the community, Mr. Speaker.
Second supplemental.
Speaker, again, with respect, those are not net new dollars, and it's not like we did nothing for people with dementia before this government came into power. So I'm going to ask about stigma, Mr. Speaker. It's something the minister mentioned. And given that stigma continues to be a challenge, both for people living with dementia and those who fear the stigma and therefore do not seek a diagnosis, again, to the Minister of Health, I would like to know what specific measurable efforts have been undertaken to reduce stigma in the 10 months since your strategy was released, and what are the results?
The Honourable Minister.
Thank you very much, Mr. Speaker. And again, we're proud to work with people with lived experience and with folks who are experts in public health around this important initiative, including the appropriate use of antipsychotics, Mr. Speaker. We are working to reduce stigma, as the member mentioned, and with partners like the Alzheimer's Society, Mr. Speaker. There is a significant effort underway, and we're proud to work with the community and support them. The official opposition wants to fire nurses and teachers. 4,000 teachers, Mr. Speaker, give a $700 million tax break to the richest 1%, Mr. Speaker. We're proud to work with the community and to invest in the things that matter to them and to support Albertans living with dementia, Mr. Speaker.
Parliament Cypress Medicine Hat.
I spent this summer connecting with my constituents, and I found time to consult with Albertans